All right, so I have George Burney, and the abnormalities with him is that he just got discharged from being hospitalized, and he has acute respiratory failure, and he also it's secondary to chronic obstructive pulmonary disease, so COPD. And he says when he walks, he walks on his patio, and sometimes he gets shortness of breath, and he cannot get out a good cough. So. Hello, my name is Katie Smiley. I am a student nurse from HAC. I will be helping take care of you today. Can I please have your name and date of birth or age?
Yes, my name's George Burney and I'm 62 years old.
Okay, and when did these symptoms start?
I have always had a cough, but it has been worse this past week.
Okay, and where would you say the overall location of this is?
I feel it in my chest.
And how long does this usually last for?
The coughing is more or less continuous.
Can you describe this feeling for me?
It feels tight and I have trouble moving air in and out of my lungs. Exhaling is worse than inhaling.
Okay, do you have any aggravating factors that make this worse?
It is worse when I exercise or have a cigarette. If I get around dust, that makes it worse also.
And is there any related symptoms to this?
It is better, well, I bring up a lot of sputum.
Okay, and what is how are you treating this?
It is better when I use my oxygen and take my inhalers. I use the inhalers the doctor prescribed and take steroids. I use oxygen at 2 liters per minute when I exercise or am short of breath.
Okay, and how severe would you say this condition is?
It has been worse in the past, so it's about 5 out of 10 right now.
Okay, and how is this impacting your activities of daily living?
Being short of breath makes me limit my activities. I do just the most important things and let the rest go. I have to take lots of rest breaks.
Okay, how are you coping with this overall?
I'm very aware of the things that make my breathing worse. When there's a lot of pollen or high humidity, I don't go outside much. I try to keep a positive attitude and keep on living.
Okay, and overall, what is your emotional response to this?
Sometimes I get down about this because there's no cure for it, but I know what I need to do and just do it.
Okay, so the assessment that I'm going to do is a lung and thorax assessment, so I'm going to start that now. So I'm first going to inspect the anterior thorax and chest. So I'm going to make sure that the clavicles are even and the chest movements are both even and symmetrical. And if I was doing this in a clinical setting, you would do it underneath the clothing and the patient would have his shirt off. But I would look at coloration, make sure that is all even. So I'm going to look at that and I'm going to count respirations. So just breathe normally. Okay, so his respirations are 14. That is good. And now I'm going to go back to the posterior thorax and lateral and just inspect that, make sure that the scapulas are even and the chest movements are both moving up and down evenly. And of course, I would look at coloration and everything like that. And now I'm going to palpate the posterior chest. So I would start at the clavicles or the scapulas and make sure they're even. And then I would locate the C7 and just go down the vertebrae and also palpate the intercostal spaces of the ribs the whole way down. Make sure that I wasn't finding any masses or bulges in there. Like that. So now I'm going to auscultate the posterior chest. So I'm going to start above the clavicles, and I'm going to have you take a deep breath each time my stethoscope changes position. And for your lateral, I'm gonna have you put your hands above your head. Take a deep breath. And the other side. Okay, good. So now I'm going to go back to the anterior thorax. And I'm gonna palpate that, so I'm gonna make sure that the clavicles are even. I'm gonna locate the suprasternal notch and the angle of Louis, and then I'm also gonna feel the intercostal spaces of the ribs the whole way down the sternum. So the ribs end down here, intercostal spaces. Next, I'm gonna auscultate it. So same thing, I'm gonna have you take a deep breath each time I move my stethoscope. And for the lateral, can you raise your arms for me, please? Okay, and that is overall the entire lungs and thorax assessment. So I have my papers, I'm gonna look that up. And that is it for George.